UBC Learning Circle hosted by the Center for Excellence in Indigenous Health. I hope you all join me in welcoming Dr. Dean Regier, and Chenoa Cassidy-Matthews from the Silent Genomes Project for our Silent Genomes Project for our final session of the season. In this session, we will explore a little bit of what the Silent Genomes Project is and the developing research designed by Dr. Regier and Chenoa Cassidy-Matthews. So before we begin, I would like to acknowledge that we are in the traditional, ancestral, unceded, and occupied territories of the Hunkaminam-speaking Musqueam people. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So as a quick reminder for everyone participating today, the topics we cover can sometimes be sensitive or emotionally triggering. If that's you for today, please engage in any sort of self-care that you need. Talk to a friend, elder, counselor, family member, whatever it is that you need, make sure that you're investing in that. So on to introductions. My name is Cole. I'm from the Chenoa First Nation. Other Learning Circle team members in the room today, but off camera, are Cynthia, our production coordinator. And with that, I think I'll pass on the introductions to you guys. I feel like you're more than confident of introducing yourselves. So, Chenoa, can we start with you?
Yeah, sure. Hi, my name is Chenoa. I am a first-year PhD student in UBC School of Population and Public Health. I am Northern Anishinaabe from Sachico Lake First Nation in Northern Ontario, born and raised in Southern Ontario, south of Ottawa, and moved to Vancouver 3 years ago. And
Dean Regier. I'm faculty here at School of Population and Public Health at the University of British Columbia. I'm also a scientist at BC Cancer. I am from Swift Current, Saskatchewan, which is a town in the southwest of the province, around 16,000 people, I think, with my ancestors primarily coming from Europe, mostly the Netherlands and parts of Ukraine. Cool. And so maybe we'll just start and get right into silent genomes. So when we talk about Silent Genomes Project, it is a large project with many moving parts. That is, it's funded by Genome Canada. It's funded by Genome British Columbia, the Canadian Institutes of Health Research, Michael Smith Foundation for Health Research, in partnership with Indigenous communities, organizations across Canada. And so the overview of the webinar, what we're going to talk about today, is really to broadly talk about what silent genomes is, the rationale for it, but specifically touch on aspects of what we're calling Activity 4, which is related to the economics and community values of the application of precision medicine genomics in context to Indigenous communities, specifically rare diseases. Okay. And so I'll touch on that a little bit. The real star, the real conversation is actually gets into it. Chenoa will be talking about some of the qualitative work we're doing, the participatory engagement that we plan to undertake. And so she'll get into the specifics of the actual research that we want to do. And the key part, of course, is Chenoa's proposed integrated knowledge translation framework. Okay, and Chenoa will describe what exactly that means, what it is, and hopefully at the end we'll try to discuss a survey that we hope everyone might want to participate in if they so wish. So with that, I might just actually get into what exactly Silent Genomes is and the rationale of the project. And so the general context is genomics and the application of precision medicine. And so around the world, genomics is gaining knowledge with a view to improve diagnosis, so what causes disease, and also trying to improve treatment options, okay? And in the best cases, what this looks like is understanding an individual's DNA and hopefully trying to tease out which treatments are most likely to benefit that individual. Okay, so in order to do this, we need a lot of knowledge, what we call genomic knowledge, okay? And we have a lot of genomic knowledge for individuals of European ancestry, okay? And so we have there's these big databases that says, okay, here is what we think is a database of normal variation in each individual's DNA. But as I said, these databases actually primarily are composed of individuals of European ancestry. In order for us to understand, especially diagnosis, we actually need to look at normal variation and the individual who's affected by a disease. We need to compare that. Yeah. Okay. And unfortunately, we actually don't have the data for individuals who identify as having indigenous ancestry. Okay. And so that is what creates the genomic divide. Okay, and that term was coined, I believe, by the World Health Organization. And because we don't have this information, this genomic knowledge, we are creating inequity in terms of access to diagnoses, and in some cases, access to treatment change. And so that genomic divide, the WHO articulates it as must be kept in check and ultimately bridged through the equitable economic investment, provision of the use of genomic services, etc., the generation of clinical research, etc. Okay, and that's what Silent Genomes is meant to start doing. It's the start of that conversation.
Right.
To start to bridge this divide of unequal access to health and in the end, I think, well-being. And so that's where we start from in terms of the Silent Genome Project. Now, just like my disclaimer, I'm an economist. Okay, I'm not a geneticist. I'm not a clinical geneticist. What I'm interested in, what fills my days, is trying to understand the intersection of humans, society, communities with precision medicine, with genomics, with a view that we want to apply these technologies in a way that advances well-being, health, and ultimately, hopefully, human flourishing.
Right.
Okay. And so, if there are any questions, by the way, ask questions along the way. We'd be more than happy to talk to it. If those questions are about specifics around genomics, I might take a stab at it, but I'm not the authority on it. Okay, I'm the economist. That's my disclaimer.
Dean, before we move on, I just want to make sure that I'm understanding this correctly to kind of frame the conversation.
Yeah.
So the genomic divide is I'm going to try and put it in layman's terms here, but essentially that research is being done on genes and genetics of people, right? And that is improving the diagnosis and treatment of some diseases.
Yeah.
And that's totally great. The issue comes when, because most of the research and the data that we have on genes is from individuals who are not Indigenous. So then when we go and try and translate those findings of that research to an Indigenous population, it doesn't work out because Indigenous populations are genetically distinct. Is that kind of what I'm under? That's the basis of the
basis.
divide.
And thank you for bringing that up and for that clarification. Also, and when we speak in terms of silent genomes, we're really interested in this. The context, the clinical context is rare diseases and diagnosis of rare diseases. And so rare diseases, just take a pause in terms of the clinical context. Is a rare disease is what's termed low prevalence. It means not a lot of people are affected by a rare disease, at least an individual rare disease. So about 1 in 2,000 people, it said, is the general statistic in terms of a specific rare disease. So very low probability of having that rare disease. Okay. But the thing is that there are 6,000 to 8,000 rare diseases. That means that while an individual rare disease is rare, collectively, it's actually 1 in 12 Canadians or people in Canada, right? So while it has this low prevalence, it also has this high human impact. And part of that human impact is what we call the diagnostic odyssey. Okay, so that's a term that we use to really try to understand the point at which a child has a suspected genetic condition. Okay. So we know something's wrong with a child, and we think that there might be a genetic cause of a disorder or a disease. And then the question is, can we prove that? Can we actually apply genomics to prove that? So that point at which first a genetic condition is suspected to the point to which they get a diagnosis can take months for some people or take years. In fact, many, many years, 15 to 20 years, if they ever get a diagnosis.
And during that time, that individual is suffering.
It's suffering, families, individuals, because it's an odyssey because there's a lot of interactions between that family, the individuals, and the healthcare system too, right? We have to remember that people travel, there's lots of clinician visits, there's a lot of uncertainty about, at least this is what the literature says about why is this happening to us. Also, there's a sense of a lack of control when you don't understand potentially the cause of disease. So this is what the literature is starting to emerge from the literature. And so that's a clinical situation that Silent Genomes operates, at least initially.
Cool. Great. Thanks for clarifying that.
Yeah. No. And so, as I mentioned, there are actually 4 activities in Silent Genomes, and we have Indigenous partners from across Canada. So the FNHA, First Nations Health Authority, is instrumental, especially in Activity 4, and the hope that the work that we will do moving forward. The Assembly of First Nations, the Métis, and the ITK. And so we're partnering with these individuals, and those partnerships are at different stages of engagement. Some are further along. But the different activities that we're meant to do is activity. So the overarching one, the one that is meant to govern the things that we do, is this engagement aspect and this governance aspect. That is, can we understand or create or help develop, co-develop through engagement, through participatory research, a governance model for genomics research, which is key to everything that we do. And so that one's actually, I'm a co-investigator on it, and I lead Activity 4, which is the economics of the thing. But Activity 1 is led by our nominated principal investigator, Laura Arbour, who's a medical geneticist, and has worked in Indigenous communities across Canada for decades. And Nadine Caron, of course, is helping to lead that activity too, and really starting to move forward these governance models of what it looks like to move forward with genomics in these contexts. Activity 2 is actually the application of genomics, so something called whole genome sequencing, which is this technology that looks at all aspects of an individual's DNA, and it's quite expensive, actually, but that's what research is there for, to help provide funds for understanding, can we better diagnose Indigenous children with suspected genetic disorders. And then Activity 3 is this building of the, what we're calling the Indigenous Background Variant Library. So in the previous slide, you said, okay, so we need to build this database of normal variation, right? In order to understand, to have a comparator in terms of understand if a variant if the genetics causes a disease. And so that's what we want to do after the governance is in place, of course, to build this background variant library of what's thought as normal variation. And then Activity 4, of course, is what we'll be getting to in some detail today, which is some of the participatory research that we're going to do, some of the economic stuff that we're going to do.
Great.
So just before we get into that, so here's the team, and this is Laura Arbour, the PI. You see Nadine Caron, Wyeth Wasserman, who's the head of bioinformatics, and we have population geneticists, we have clinical genetics, and then we have this great. It's one of the International Indigenous Council, the genomics perspectives from around the world, includes people from University of Washington, Nana Begaris, who's also involved in Activity 4, Kim Talbert. These people are great in terms of providing guidance, thoughtful guidance about ways to move forward. And we've learned a lot from them, actually. So we had this big gathering ceremony in Victoria last year, and had people from all over the world come to talk about silent genomes. And it was a really brilliant experience. And then, of course, our end users and partners, which incorporates the FNHA, the BC Ministry of Health, and all these people. So it's a big team, and there's a lot of moving parts. So I don't know if I could say that enough. And so Activity 4 really wants to start to look at the economics of the application of genomics in context to improving Indigenous health. And so, as we were discussing before the webinar, there's a lot of, let's take a drink. People have a lot of ideas about what economics is. Some people think it's money, some people think it's markets, the economies, interest rates. But as an academic discipline, the raison d'etre, the reason why we have economics is we want to study how resources are allocated in order to improve well-being.
Okay.
And the idea is that resources are scarce. We don't have unlimited land. We're killing our environment. We don't have unlimited ability to live in a healthy way. And so how do we use those resources in order to actually have benefit to meet the needs of people, of communities? Okay, and so as I mentioned, resources can include this labor. So how do we use our time to generate goods that meet people's needs? how do we use our land, how do we use our capital in order to actually address the needs of individuals. And so that's what we call resources. Well-being in economics is characterized by individual and community values. This idea of value is like a bit of a nebulous term, I understand that. But we try to understand how people value different aspects of their life, not just different like cars or houses or food, but actually how they value their quality of life, how they value their well-being. And in economics, we do this through this concept of what we call utility. And so what we want to do is we want to actually, the whole aim of economics is to distribute these scarce resources in a way that is consistent with values, with what people want.
And those values would be determined by the community.
Determined by the community, exactly. And that's the key aspect that I think that a lot of people forget in various economic disciplines, including health economics, is that we're really interested in the affected individuals, the people who actually are using the good, who live their lives in context to the different parts of the economy, is that we're really interested in their values, their perspectives. Okay, and when we distribute resources in a way that is consistent with individuals' values, we call that efficiency. Okay, so that's economic efficiency, and sometimes we think of efficiency as like the least cost option is the best option. That's efficient. That's not efficiency at all.
Right.
That might be a part of the conversation, but actually efficiency, we could spend a lot of money on something specific, and as long as that's valued, highly valued by individuals in context to the other bits that they can spend their money on, then that will be economically efficient. And then in healthcare, and this is a big part of our conversation, is we also want to achieve equity of access to healthcare to meet the needs of individuals throughout, for example, the province of British Columbia or Canada, et cetera, right? And so that's a big part of course, Silent Genomes, the rationale, but also a big part of what we want to try to do in Activity 4, is try to understand the equity context.
Okay.
And so when we were parsing these ideas out, when we were starting to write the grant, we got together to try to think, okay, should there be an economics component? How would we understand the economics of silent genomes? And so we parsed this out into 4 different ideas. As we discussed values, and this is what Chenoa will be talking about today, is we want to document the acceptability of whole genome sequencing, so that's WGS, and the Indigenous Background Variant Library, IBVL, in context of children with suspected genetic conditions from the Indigenous perspective, partnering in partnership with Indigenous First Nations communities. The equity aspect is challenging. So we know that there's unequal access to genomic technologies. That has been stated time and time again, but the evidence to support those claims and the degree to which there is inequity there's not great, in fact, no evidence for that. And so we want to start to generate some of this evidence. So what we want to do is we want to document this diagnostic odyssey, that what I was talking about earlier, of Indigenous children with these suspected genetic conditions. So like, how long does it take? What kind of barriers are they facing? And provide some evidence surrounding that question. And then indeed compare that to look at the diagnostic odyssey of non-Indigenous communities to try to figure out the degree of inequity. To start providing that evidence base and furthering discussion about equity in the context of genomics for many years down the road. This is not just, so this is a 4 to 5 year program, but we want to carry this forward in a way that's sustainable if it's in partnership and if it's valued by, of course, the communities.
If I just may here, just for a second, Dean. So as I'm listening to this from my perspective, and keeping in mind the historical context of the country that we live in, it sounds to me, and after meeting you guys and getting a really good perspective on the program, importantly, this data isn't just being gathered for the sake of gathering data. It's not just for people to poke and prod Indigenous children once again, as we're all acutely aware of how often that happens. particularly when we're talking about documenting this diagnostic odyssey, it seems to me that through that conversation, we both validate the existence of this program and the resources that are being allocated to try to address this inequity or that gap, let's say, in care or in access to genomic healthcare, but also then to stimulate more work, right? Because the way that these projects happen is, people sit in a boardroom and they have to have figures, right? Which is unfortunate, but somebody has to have the figures. And correct me if I'm wrong there, right?
Yep.
So that, and we've talked about that, and thanks for articulating that. We talked about that from the beginning. This is not a one-off thing. This is not 4 or 5 years. This is decades, and we need to pursue this and with a view to reduce these inequities, and that's the whole reason for it. That's the whole rationale. So and a part of that evidence, that boardroom conversation, is actually also looking at the economic models. And which is where I come in.
Right.
And so we want to look at those economic models and to look at, because these technologies can be quite expensive and because there are varying priorities for spending money, it's not only we can spend money on genomics and genomic technologies, for example, but there are very important other ways to spend money on our scarce resources in terms of health and well-being. Different programs will be competing for eventually the same aspect of the budget. And so we really want to look at is it valued, and are we spending our money, our limited budget in a way that is valued by communities, by Indigenous communities and families. And so that's where the economic evaluation comes in. And then finally, and I termed this as the future, I guess, in the Silent Genomes gathering last year, but it's not the future because the future is now. We have Indigenous scholars, and we want to enable Indigenous scholars to actually move. We're talking about decades of research. I'd like to hope, and I don't know if I've articulated this to Chenoa, is to develop Chenoa and colleagues to actually lead these projects of health and well-being. And say, hey, you are the Indigenous scholar. This is yours. Take it forward. I believe, I think that Chenoa probably is one of the only that I know of, at least, an Indigenous scholar who's also intersecting with economics. And so, so we want to really develop these, and the future's now. And you'll hear what Chenoa, how she's going to lead and co-lead some of the activity for stuff. We'll see that in a moment.
Great.
And so I'm going to be quiet and this is my last slide, I promise. This is the last thing I want to talk about. And so this is the bird's eye view in terms of trying to understand, from an Indigenous perspective, the views, acceptability, harms, and benefits of genomics for families, for communities. And we're going to do this, it's called mixed methods research, which just is a term to say, hey, we're doing both qualitative research, talking to people, focus groups, individual interviews, to try to look at these risks, these benefits, these ideas of acceptability from their perspective. And then we're going to do this quantitative research to try to actually put some numbers around acceptability, to put some numbers around cost effectiveness, as I mentioned, etc. And so we get this harmonization of both the qualitative, the story aspect, the views, and also this number aspect which also, as you mentioned, boardrooms seem to like quite a bit. So that's me. We can pause our questions, or we can actually also just get Chenoa to move in.
Yeah, I think now is a good time for some questions. We have some from Amy. So thanks very much, Amy, for engaging in the chat. I have a couple questions that may be answered later, and I think we can kind of decide that as a group. Who will own who will own the information and data gathered once the grant is over? Really important question. Also, does the grant take on a CBPR approach, community-based participatory research? So does that feel like a question that you guys can answer?
Yeah, I think that's or do you want to address it later? So.
I have a slide where I will talk about it, but thanks for the question, Amy.
Okay, yeah, so we'll get to it. Thanks very much, Amy. Show us what you got.
So Dean's disclaimer that he's not a geneticist. My disclaimer is I am not a geneticist, and I am also not an economist. But I come from a public health background, and I've worked with Indigenous communities for a couple of years and a little bit of time in Australia, so I'm bringing those skills, I guess, to this project. So I want to take a step back from the economic kind of focus of the presentation, because before we can do any sort of quantitative analysis or talk about anything specific, really, we have to first understand what is valued by communities and really understand that there is not going to be one large or broad cookie cutter framework that we can then use to make the case for health services across all communities. So these will be community-specific approaches, and so that also applies to our research and my research. And so what I want to do is, once I partner with specific communities, which I'll talk about in a second, I will conduct qualitative research that is in line with agreements and discussions that I have with those communities. But broadly, I want to do focus groups and interviews with members of communities across British Columbia. And first, with the focus groups, I want to gather up the breadth of values and perspectives within communities to get a really holistic understanding of different preferences across the lifespan, across different roles people play in communities, etc. And then with interviews, I want to talk to people who have experience accessing genomics-informed healthcare. And so the difference between the two sort of data collection periods, I guess, will be in focus groups, it's more hypothetical questions. So what if you were to be in the situation, or somebody you know was in the situation where they needed to seek medical care that was related to a genetic linked rare disease, what are your values associated with that? But in the interviews, it'll be more of what was your experience in the situation? What were the risks and benefits? How did you weigh the pros and cons? Okay. Things like that. So questions will address hopes and concerns, challenges, as well as how people would want to receive the results of tests, who they want to speak to, who they feel safe sharing the information with, what kind of samples that they would be willing to share, how those might be returned, all these different pathways, and then ethical considerations. So what are the barriers to even participating in not just this research, but participating in healthcare? Like, what are the barriers to accessing healthcare on a personal level?
Right.
And so through this, in the interest of change-oriented research, I don't want this to just be an exploratory period where we collect qualitative data on perceptions and preferences towards genomics-informed medicine, but we actually make it useful. So we don't just publish something, say, that just shows the data and key themes. I want it to be useful. So this is why I was interested in the first place in participating in an economics study, because we can use this data to inform Indigenous-centered attributes of the experience of quality of life and preference-based value for using genetic information. And that, as Dean has said, can be used in a really useful way for communities and individuals. Mm-hmm. And so specifically through this qualitative research, I do want to hit on risks and benefits of genomics-informed diagnosis and identify concerns and challenges regarding the acceptability of these technologies within community.
Okay. Yeah, of course. Okay.
And so I just want to reiterate the importance of this project, specifically Activity 4.1, the qualitative piece here, because as Dean mentioned, the World Health Organization coins this the genomic divide, but provides very soft recommendations for how to bridge this divide, saying that we should focus on economic investment, clinical research, and accessing services. That's their solution. Just improve access to services. Well,
Right.
that's fine, but in a system that has been designed to exclude certain populations, like our own First Nations populations, you can't just do that. We have to actually start from the ground up, and for us in Silent Genomes, that is to understand first what First Nations and Inuit and Métis, but I mean in the context of Activity 4, it's for now just First Nations in British Columbia, but what our attitudes are, views and preferences towards genomics and precision medicine in communities, and what steps we need to take in order to get to a place where we have equitable access to genomics-informed healthcare.
And maybe even start to provide that care that's not the cookie
Yeah.
cutter approach that
Yeah.
you mentioned and that you articulated, but that is actually designed for the communities, for families.
Based on the values of the communities, yeah.
Yeah, if anything is going to be cookie cutter here, it'll be protocol that we can share with others in similar situations, say in different provinces or different regions, even of British Columbia, for how to start the process of developing a community-based framework for improving access, or how to build, say we come up with some sort of economic model, we can then help others do something similar that suits the needs of communities in their region.
Importantly, that would only ever really be applied to the research team behind the research, and not to the communities that are experiencing the research.
Yeah, exactly. There's also the opportunity here, I guess, for communities to take more of a leading role too. So say communities are really engaged with our research and they want to champion the community side of things. That's also something that would be very exciting too. Okay, so this is where I want to talk about a little bit of Amy's question. So I just want to mention cultural safety and ethics a little bit here. Genomics medicine and research, specifically genetic research involving Indigenous peoples, has a very dark history. And that brings with it a lot of trauma and inherited trauma, and things that need to be taken very seriously in order for a project like Silent Genomes to work. So within my research design and approach and engagement strategy, I've kept it intentionally broad to keep space for community-specific needs, preferences, and protocols, because this is very early days in my PhD, and I started my PhD when Silent Genomes started, so it's the same for the project. It's very young, and we have key partners, and we are working with the First Nations Health Authority to develop, well, at all levels actually, of design and community engagement in particular. But there is only so much that I can say here today without having actual specific community partners. I don't have, I don't want to provide too much of what I think or what I envision a framework might look like, because that would kind of be my own researcher bias on what I eventually work out with communities.
Okay.
So if, I guess if viewers are regular viewers of the Learning Circle webinars, you might be a bit more familiar with cultural safety, but cultural safety describes addressing power imbalances that are inherent in the healthcare system or in research between everybody actually, but particularly between researchers or physicians or nurses and patients or research subjects or participants. And cultural safety is not an end goal. It's not like a checkbox. It's really a journey, right? And everyone has to start somewhere, and it's about learning and it's about humility. And the First Nations Health Authority has a lot of resources on cultural safety and humility, and ways to sort of teach that and to be reflexive as healthcare practitioners and researchers. And so I really strongly recommend looking at those resources. And as a team in Silent Genomes, everyone at BC Cancer that is involved in Silent Genomes has or will be taking the PHSA SANYAS cultural safety training as a starting point, just to get us all on the same page, but recognizing that there are future steps we need to take as a team as our research rolls out to ensure that we continue to work towards a more culturally safe research environment. And I also want to talk about Ethics. So we have ethics approval, but as many of you might know, ethics approval, the ethics requirement stops at the Tri-Council Policy Statement, Chapter 9, which is heavily critiqued Indigenous health research, and so we have built in the principles of OCAP into Silent Genomes as best we can, and that's part of the reason why I don't provide too much information about, my approach to the project or specific engagement protocol, because I need to know who I am actually working with before I can even begin to design protocol for collecting data. And so what I envision is once we engage with specific communities, we are going to work on agreements that cover things like ownership of data, control over the data. So OCAP stands for ownership, control, access, and possession. And it is supposed to protect Indigenous peoples involved in research, but flipping the control over data and analysis and through a number of different channels. So ownership would refer to things like who has, ideally legal ownership over data and the rights to that data, control over what happens to the data. So if, for example, somebody wanted their data pulled from a study, not published even, they should have the right to do so. Access to the data, and possession of the data. So possession of the data is a bit of a tricky one. Some communities don't want to have to go through the process of managing their own data, having the physical infrastructure to hold their data, so there are trusted third parties. And all of these things will be negotiated with specific partners in Activity 4, which I think is a really important piece of this project, which makes it a little bit difficult to host a webinar to teach you or to share specifics of what we're doing, because we're still pretty early, but that is our intention, and we are working with First Nations Health Authority to begin this process. I hope that answers.
Yeah, so again, because I don't work in genomics, I'm going to try and catch up a little bit, make sure that I understand. So we were talking a lot about, interfacing and negotiating and communicating with community. It seems to me from the very first step in terms of building contacts and then going through the process of establishing values and establishing, kind of what the community wants out of this data, and then the actual process of collecting is down the road, I guess. But so in a nutshell, when I'm looking at Amy's question, who will own the information and data gathered once the grant is over? You can't provide a specific answer to that. But what it sounds like to me is that you can't provide an answer because that would be individualized to each community and their needs and what they wanted done with the data, correct?
Yeah.
Okay.
Absolutely.
So at the end of the day, if we're talking about I'm just going to say general. I don't even know if this term means anything in genomics, but let's say sovereign control over the data, right? Sovereign control over what is your information that would always reside with the community at the end of the day.
Yeah.
Okay. And in terms of possession and all that, like you said, that's a little bit complicated because I imagine it takes quite a bit of infrastructure to house and to manage a database like that maybe some communities don't want to spend resources on, as we talked about, value, right? But at the end of the day, they're going to have complete control and the ability to access their data and kind of what happens to it. Is that correct?
Yep.
Yeah. Okay.
I should note that I can only speak to, so this is echoed throughout Silent Genomes, but I can't speak to the process that's involved in activities 2 and 3 because that involves a lot of pathways that that's completely out of my field. But so what I'm talking about today is specifically the qualitative data that we are collecting.
Right.
Well, I guess, and quantitative data eventually down the road. But so specifically housed in Activity 4. That's our approach to.
So that same pathway is, but what Chenoa describes is very much the approach that the Silent Genomes team is taking on in general.
Yeah, like
so
as
that's
a general
what these
team.
governance models and this engagement and these controls. So those are being developed right now as we speak. As Chenoa has said, we're only just a few months into it, and so these will emerge and be articulated. once things are more mature in terms of the process through the project.
Right. But it's these basic principles, that govern the direction of the project and influence everything that's happening within all the other activities.
Absolutely.
But we are specifically talking about activity 4.
Yeah.
Yeah. Okay.
Yeah, exactly.
Cool. So that clears a lot up for me as well. So thank you very much.
You can. You can't go back and try to recreate data sovereignty. You have to start with that.
Totally.
Right, so that's what we're trying to do. So it might be a little bit of a grind at first, it might be a bit slow, but at the end, it'll be much more sustainable and useful and ethical. Ethical being the big one.
Cool.
Oh, and is this community-based participatory research? I would say yes, but it's not. I don't know. Silent Genomes is huge. I wouldn't know how to answer that for all of Silent Genomes.
I think for activity 4, that's very much.
Yeah. So activity 4 will be a much smaller, I guess, sample. So it'll be driven by communities. Okay, so progress to date. We've developed interview and focus group guides. Like I said, the questions are similar. We're trying to get at the same points, but just from different perspectives. So focus groups will be with as diverse a range of community members as we can to facilitate, to gather the broadest or the most holistic picture of values and preferences within communities. And so it would be largely hypothetical, and the interviews will be more about actual experiences, but with the same line of questions. We have ethics, like I said, but it's not satisfactory for us. We're still we're still abiding by OCAP as our main ethical guiding principles. And so for engagement and implementation, we have started to draft a knowledge translation plan, an integrated knowledge translation plan, which is our IKT. And that's in collaboration with the First Nations Health Authorities. This is very early. Again, I can't stress this enough. We haven't tested our framework. We haven't actually really used it except for today. So today is the first time we've engaged in any sort of knowledge exchange. So it's a little bit scary for us. We don't know if it's actually going to work in the way we want it to, but we are really hoping to get lots of good feedback today and start building partnerships outside of just communities. We would love public engagement in this work as well. It helps hold us accountable, and it helps us set a good example for others in the future. And so next steps, we have a survey, like was mentioned at the beginning. I think there's a link to it under the video. But regardless, there's a survey after that will just ask for some feedback, and if you had any questions, and there will also be an opportunity to join what we're calling a knowledge network, which I'll talk about in a few slides. And then next in our research design is developing a recruitment strategy and starting the process of meeting with communities and things like that, which we are doing with the First Nations Health Authority. We are taking a decentralized approach. So basically we are working with partners in the core of FNHA, but really we are going to go out to the regions specifically to start to make those connections. And so our IKT plan, essentially what I wanted to do was create some sort of model that hits on 3 really important perspectives in conducting research and sharing research and making research useful, as I said, and from a change-oriented perspective. So how do we hold ourselves accountable as researchers? How to appropriately interact with Western approaches to research? So that includes things like health authorities and institutions that are largely Western and are big machines with systems and bureaucracies. How do we work with that? And third, how to ensure we meet the needs of communities. That shouldn't really be third, but anyway, so that's central to our IKT approach. And this is a little squished, that's okay. So I'm not an artist, and I haven't made this look like anything yet, but essentially what I envision, I should mention that I drew these 3 frameworks from a really useful resource that came out of the National Collaborating Center for Aboriginal Health. I think that's the acronym. And so these are 3 separate frameworks that cover those 3 different perspectives that I found. And so I envision them on 3 axes. So along the bottom here, there is the different ways in which we will interact with broader Western systems, from left to right, broadening in scope. So starting with Indigenous communities, how to help communities interact with Western systems and facilitate that those relationships. So, for example, providing economic models is one way to do that. And all the way on the other end of the line, we have changes to health services. So, creating enough evidence and creating enough community action that we can actually influence changes to policy and changes to health services. On the left, how to hold ourselves accountable as researchers are just questions that we need to continually ask ourselves and hopefully write about and make public and share with our knowledge network, but also to maybe publish as we go. And on the right, we have how to meet the needs of communities. So this is a framework that was actually developed for communities engaging with research. So questions communities need to ask themselves to make sure that they are involved in a way that is suitable to their needs. But I flipped it so that it is there are questions that we can ask ourselves to make sure that we are taking a community perspective in our approach to ensuring we meet the needs of communities, if that makes sense.
Right.
Yeah. So
Two-way conversation.
Yeah, exactly. Yeah. And I've sort of loosely aligned them to be in categories that can be used in a way that is presentable to a more Western audience. So we can create, some sort of chart out of it maybe, or infographics if we make some artists friends who can draw things for us. So there's lots of potential here, and again, it's very new and we haven't tested it out yet, but that's what we're hoping to do. So.
Great.
And last but not least, our follow-up survey. So we just want to kind of get a sense of the audience today and measure engagement and how effective we were in communicating our research in its early stages, and ask for feedback on what we have presented. I know it's not a whole lot, but if there's anything that we missed or perspectives that you think should be included, we would greatly appreciate it. And I'm really excited about creating a knowledge network. So in the survey is completely anonymous, except for the last part where you can sign up via email if you choose, if you would like to participate in ongoing knowledge dissemination activities. So those might include, so essentially it's an email list, but you will be invited to engage in events like this where we share progress updates or simply just newsletters with progress updates and opportunities for giving feedback and collaboration and things like that. And if you are interested in this project and want to play a bigger role in the project, we invite that. That would be really cool. And Cynthia's posted a link in the chat, and there should be one on the website as well. And
yeah, so some of that kind of feedback that we would be brilliant is to say, hey, you forgot this in your knowledge translation framework.
Yes, absolutely.
Here's how we think you better revise it. And so we don't want it to be coming from just Chenoa or just some Silent Genomes, but have broad feedback and start this conversation, these two-ways conversation about knowledge, participation in research and knowledge transfer, etc. And so we really want that to be like a focus. And I think Chenoa is doing a brilliant job of it, but just to continue making sure that's central to what we do.
Right. Right, yeah. I think like it seems we're at such an early stage with the project that this is a prime opportunity for our
Absolutely.
audience and community members at large. As they mentioned, we'll try and spread the survey around. It'll be available on the YouTube link if you're watching this later. Just check that out. To really have an impact on not only the research that's being done, but how it's being done. Is that correct?
Yeah.
Yeah.
Absolutely.
Okay.
Yeah.
Great. And
Final words?
So, I mean, this is just the final slide, and those logos are all the people who are involved, and there's going to be many more people too, and hopefully, like people listening today, will start to become involved too through the Knowledge Network, etc.
Right.
So I think we'll just open it up to questions, a conversation, if there are any.
Yeah, we do have one. I think it's a really great question. From Ashley, it sounds like the sampling of the qualitative element focuses on First Nations individuals living within their communities. Is this accurate?
Well, I would really love for it to include urban as well. This is something that we've brought up in our meetings with FNHA, and this is something that I know the FNHA is grappling with currently too, is how to reach urban Indigenous peoples. And as an urban Indigenous person myself, I really want to see myself represented in my research in that way. But as it's worded, yes, it's currently just living in communities, but that is something that I would like to change eventually.
Yeah, so we've actually, the thing that we wrote down was initially communities, and then Chenoa was like, the urban context is super important. And so we have these things called research oversight committees, which it happens twice a year, and we have to say, hey, this is where we want to improve upon our research through the oversight committee, etc. And so that's what I'll be presenting next time, and it will be approved, I'm sure, because it's a good use of our time. In terms of just broadening. So the general idea of the qualitative research is to get this diversity of perspectives. And the more diverse, the more people we can engage with varying backgrounds and ideas and values, the better the research, I think, will be in change, in partnership, etc. And so, we want to expand, I guess. Is
okay. Yeah. So then kind of a follow-up question, how have we even thought about at this stage how you're going to approach establishing and upholding OCAP principles for groups that are not clearly represented by a governance body like Chief and Council or something like that?
That's a great question.
That's a good question.
I don't have an answer.
Okay.
That's a question we're going to write down and then try to...
That would be, actually, that's a really interesting point, because that should be accounted for in our research. That should be something that we consider, especially if we want to bring it in an urban context, right? My band council wouldn't know the first thing about me participating in research in British Columbia, which is, so that's something I'll keep in mind.
Yeah.
Great. I mean, I think that's why we do sessions like this, right? To generate
really
some feedback and to get as many as many perspectives as possible. So thank you very much, Ashley, for that question, and I'm sure that it'll make an impact. If you have other questions or comments or anything like that, I imagine this is the type of feedback that would be really beneficial to have in the survey as well, right? Because then it's recorded, and you guys can bring it in front of the whoever needs to see it, right? So we'll give it a second here to Melanie, great presentation. I'm not going to try and pronounce your last name. I apologize. Melanie here, Principal Scientific Officer of the Canadian Donation and Transplantation Research Program. We are interested in access to transplantation, particularly in Indigenous communities. Would love to collaborate in terms of determining specific HLA signatures to Indigenous communities. Great. So thanks very much for watching, Melanie. Really appreciate that. I'm sure that we can pass on some contact information and you guys can connect whoever else needs to be connected into that conversation. Really, thanks very much for watching, Melanie. Appreciate that. If talking to Laura in a few minutes. Okay, great. There we go. That solves that. If there are any other questions or comments, feel free to populate the chat box. I'm just going to do a quick plug, kind of the end of the year thing, and while I'm doing that, like I said, feel free to post anything you have. So this was our last session of the year for the Learning Circle. We really appreciated everybody's participation and kind of being here with us today. From the bottom of my heart, it meant a lot to us, and I'm really grateful and happy to be along this journey with all of you. in bringing this knowledge and sharing all the wonderful expertise and knowledge that's represented on the learning circles across the year. So I just wanted to say thank you very much for allowing me to be a part of that process. We'll send out a little bit of information in the next week or so. We'll have a year-end thing. It'll have some an infograph on it that'll represent some cool statistics for anybody that's interested in how the Learning Circle is doing. But apart from that, the next session will be in the fall. We're looking to do all sorts of stuff, highlighting the Get San Dementia Project, and talking a little bit about kind of more community unsung heroes in health, perhaps some community health nurses and that sort of thing. So generally as well, if there's any topic, we're going to be sending out a year-end survey, so there'll be plenty of time for you to do this as well. But if there's anything specific that you'd like to see represented on the circle, anything that we're missing, any feedback at all for either myself or Cynthia, we'd really, really appreciate your feedback. So feel free to email us or indicate it in the survey. And like I said, that should go out in the next kind of week or so as we kind of shift gears and focusing on that. So it looks like at this point, thank you very much. I can't hoist in boardroom. The FNHA, I'm hi. Thanks very much for participating with us today. I really appreciated having you. And I think you're one of the first BC participants for the year. So thank you for ending on a strong note there. I appreciate that. It looks like from my communication tools that we don't have any other questions, but I'm sure that if you'd like to take the time to put anything into the survey at all, that, I'm talking about Activity 4 survey now, please do that. I urge you to take an active role in kind of shaping this research, as it's so important, or it seems important based on what you guys have shared with me today. And as I mentioned before, if you missed this session, the survey link will be on the YouTube video, and you can feel free to participate in that way as well. So with that, I wanted to thank you both very much for being here today. I had a great time, and it was very illuminating.
Thank you so
for
much.
Me. Until the fall, I guess. Take care, everyone. Bye-bye.
Bye.